Welcome to today's event. My name is Freya Richterink, and I'm the Executive Director at the Policing Project. We're here today as part of the Policing Project's Reimagining Public Safety Project, which is a national initiative focused on the notion that we as a society have asked the police to do too much, and it just isn't working. It isn't working for the police, it isn't working for communities, and in particular, it isn't working for Black and Brown communities who disproportionately experience the harms that have come with this equation. As a part of this project, we've been conducting research on community safety needs and alternative response in cities across the country, including Denver, San Francisco, Tucson, Chicago, and Minneapolis. We're also creating guidance for cities that are looking to implement alternative response programs, and you can find that guidance on our website, safetyreimagine.org. And we've also now launched a community of practice, which brings together practitioners and other stakeholders to learn and problem solve together. The purpose of our conversation today is to take a deep dive into the workforce of alternative response. And we have an incredible group of panelists gathered here who are going to be talking about issues including training, recruitment, workplace culture, and a whole lot more. I also want to mention that we're co-hosting this webinar together with the Georgetown Law Center for Innovations in Community Safety, and we're joined here today by their Executive Director, Tahir Duckett. The center is doing really important work on community safety issues and police reform, and we couldn't think of a better partner to be doing this webinar with. For those who don't know Tahir, he previously was a civil rights attorney and a labor organizer, and he's the founder of Rethink, which is an organization dedicated to preventing sexual violence, among many other things and achievements. So with that, Tahir, I will pass it over to you.
Thank you so much, Freya. I really appreciate it. My name is Tahir Duckett. I'm the Executive Director at the Center for Innovations in Community Safety here at Georgetown Law. We call it KICS. And we are working to transform our system of community safety to make it healthier, fairer, and more oriented around the prevention of harm. The way we see it, policymakers have viewed community safety through a singular lens for decades, and that's law enforcement. And that's created two problems. One is it creates fertile ground to exacerbate the harms of policing. For example, you might have heard that 1 in 5 fatal police shootings nationwide involve a person in mental health crisis. And second, it's created an overly narrow approach to community safety. So at KICS, we're taking a two-track approach to transforming our system. First, by reducing the harms caused by our over-reliance on policing, and second, by supporting the development of programs that can reduce our overall reliance on policing, with a focus right now on alternative first response and hospital-based violence intervention. The promise of a new generation of responders better suited and better tailored to the needs of residents is enormous, and it's undeniable. But we'll never see that promise fulfilled if we don't make sure that we're meeting the needs of the workers who make these programs possible. And so we're absolutely thrilled to be partnering with the Policing Project on this critical webinar. And I'm equally thrilled to be introducing Evan Douglas, the Public Safety Innovations Manager at the Policing Project. In addition to his experience as an educator at a school in Southeast DC, he's a double alumnus of our team here at KICS, a graduate of our Police for Tomorrow Fellowship while he was an officer with the Metropolitan Police Department, and later a program manager with us as well. So Evan, great to be working with you again, and I'll pass it to you.
Thank you so much, Tahir. Thank you for the introduction, and it's truly a blessing to have you and the KICS team as co-hosts with us today. My name is Evan Douglas. I'm the Public Safety Innovations Manager here at the Policing Project. This conversation for me is not only timely, but personal as well. From 2016 to 2021, I served as a police officer in Washington, D.C. From the last administration's inauguration to January 6th, I've been through it all and seen it all. But when I wasn't downtown, I was in patrol, and I was assigned to the Ward 8 community about Southeast DC. For 5 years, I responded to countless 911 calls on my beat. And, to be honest, plenty of the calls that I went to, I asked myself, why am I here? Why am I here? Whether it was a call for someone who had just recently overdosed, or someone who was experiencing a mental health crisis, or even a loose dog. I knew that someone was better trained to deal with these issues and to give the community the assistance they really needed. With all that said, I'm currently working on our Reimagining Public Safety project, and I hope that we can change the first responder space. Enough of that and enough about me. Now let's get to today's panelists. We're going to do a quick round robin of our panelists, and they're going to briefly introduce their jurisdiction's alternative response program. Let's start off with Ms. China Corker from Atlanta.
Thank you, Evan. My name is China Corker. I am the Director of Community Response Services at the Policing Alternatives and Diversion Initiative in Atlanta, where we offer pre-arrest diversion services as well as a non-emergency community response through our city's 311 line. And we are the first city in the country to be able to provide non-emergency response through 311.
Thanks, China. Let's kick it over to Jasmine Desiderio from Albuquerque, New Mexico.
Hello, everyone. My name is Jasmine Desiderio. I'm the Deputy Director at the Albuquerque Community Safety Department. We are a cabinet level department in the city of Albuquerque, which is considered the newest third branch to public safety in Albuquerque, New Mexico. We respond to 911 calls related to behavioral and mental health crises in the community, which ranges from homelessness to those who are unsheltered and suicidal ideations. Previously, before ACS was created and implemented, these type of calls would have gone to police or fire to respond to. And now that we've actually responded to over 27,000 calls for service, diverting over 16,000 from the police department.
Great work. Now let's pass it over to Daniel from Alameda County, California.
Thank you, Evan. It's an honor to be here with everybody. And I'm with Alameda City, so there's a little bit of a distinction there. I'm the president of the International Association of EMS Chiefs, and I'm the EMS coordinator for the City of Alameda Fire Department. We have a crisis mobile response team called the Alameda Care Team, and they respond to patients that are in crisis that need assistance. Previously, this service was provided by the police department, and after an incident in the community, the police department wanted to transition out of this space, and so the mayor approached the fire department to see if we would step in. We currently staff our unit with a paramedic and an EMT. We have a telehealth option with a licensed clinical social worker, and they could either phone in and provide support, or they can respond directly to the scene. And then we do have some police response with our team members, but this may change based on some of the dynamics we're experiencing. We have like a very low threat level, and the police might, we might transition the police out of this space. And again, thank you for having me.
Thanks for being here. And last but not least, Jason.
Thank you, Evan. I'm Jason Lerner. I'm the Senior Director for 911 and Crisis Response with the University of Chicago Health Lab. And so clearly I am not, nor have I ever been a first responder myself. I'm here to bring the research perspective to this discussion. So at Health Lab, our work is done mostly at the nexus of public health and public safety, with a primary focus on 911 and related emergency response, but also substance use treatment, as well as diversion and deflection, housing stability, healthcare systems improvement, all with critical attention paid to the interactions between those systems with that of health and healthcare systems. So we really take an ecosystems approach. I myself am trained as an attorney and a social worker. From a clinical perspective, I have experience in substance use treatment and community-based social work, and that community-based social work is something I do often fall back on when thinking about crisis response. And I was not responding to 911 calls per se doing that work, but responded in lots of cases in the aftermath of a 911 call. So very excited to be here. Really want to thank the Policing Project for their partnership. You guys have been great partners on a number of projects with us. I'd also be remiss without recognizing Jasmine and her colleague Mariella at the Albuquerque Community Safety Department for their partnership, as well as China and her colleague Moki Masias at PAD, both of whom were partners with us on our Transform 911 project, and we're grateful for your partnership there as well.
Thank you, thank you, thank you. Thank you, Jason, for sharing that. Let's jump right into the questions. Jason, you work with Chicago's Health Lab, and you guys work with several different alternative responder programs. Can you kind of paint us a landscape and a current picture of what the alternative responder scene looks like? Who's responding to the calls, what kind of background do they have, and who's doing what?
Yeah, thanks for that question. I think we have the good fortune of working in this space at a time when there are seemingly endless amounts of experimentation and testing of new strategies happening. Within the greater alternative first response framework, which I think folks typically think about in the context of mental health, behavioral health, issues like homelessness and substance use response. There are really a variety of team models out there with a range of possible personnel and team configurations. But I think in general, the roles we tend to see and hear about most are that of first and foremost, mental health clinicians and crisis clinicians. These are often, but not always, master's level clinicians in social work, counseling, psychology, or similar field. There are the medical providers that are often part of these teams in the form of EMTs or paramedics, particularly community paramedics who have been trained in community-based health care, where they're working really outside of their normal emergency response and transport roles. There are also programs that include nurses. In fact, Cahoots in Eugene, Oregon, which is one of the more well-known programs, does employ nurses. Police are sometimes part of these teams, and I think it's important to sort of recognize where and when that is happening. These are typically CIT trained officers. Of course, there's an active debate about whether or not police should be included in these teams. Sometimes what we'll see are teams that include a police officer when responding to higher acuity calls, so calls where there's an elevated level of risk or greater amount of unknowns. I think at the very least, it's probably smart for alternative response teams and police to have operational awareness of each other, since they're typically operating in the same fields. And then I think it's also important to recognize the importance of the role of peers in this work. These are folks with lived experience who have deep knowledge of the communities they work in and connect with people that they're responding to on a different level. They're often deployed as peer specialists and coaches. And finally, I would say, I would make a pitch that we should consider 911 professionals themselves as first responders. We don't talk about it very often, but these alternative response teams and models really hinge on the ability of 911 professionals to correctly identify and triage these calls. So their role is currently considered a secretarial one by the Bureau of Labor Statistics, which really kind of misrepresents the role, but they are a critical factor in the success of these teams as well. You also asked what sort of issues the teams respond to, and I think, again, we often think of these as sort of mental health, behavioral health responses. That's at the forefront of most people's minds. But of course, people call 911 for a wide swath of reasons, and we're starting to see some programs that I would call represent a more robust ecosystem of responders and responding to things like traffic incidents, alarm calls, noise complaints, and other non-emergency quality of life issues.
Thank you, Jason. That was definitely a huge spectrum of individuals and specialists and just people who are doing different things in different configurations of these alternative responders. But I'm curious, with all these different configurations and all, what does the day-to-day operations look like for some of these units? Are they 24/7? Are they a couple of hours out of the day? Are they certain hours? What do they even wear? Do they wear uniforms or plain clothes? I'm hoping that China or Jasmine can add what their jurisdiction does when it comes to the day-to-day operations. China.
Yeah, so at PAD, we respond in a two-person team, and I think it's really important, and I always note this when talking about our work, that we show up in our PAD t-shirt, our jeans, our khakis, because we are not there to sort of emulate a system or enforce any sort of law. And I think it contributes to how we are sort of received by the community when we are responding to these non-emergency calls, to just sort of show up as we are, to meet people where they are, and provide that level of support. We currently operate 7 a.m. to 7 p.m., which is in alignment with our 311 non-emergency call center. And that is so that we have sort of an operating body to sort of field our calls and allow us to be able to respond. I think there are many, requests for these sort of programs to be 24 hours a day, 7 days a week. And while it is needed, I think that there is a real need for infrastructure, right? Like we need 24 hours a day, 7 days a week shelters and resources and centers for us to be able to, provide folks with food and all of the many things that we are often called out to sort of support. So for as long as cities are wanting a 24/7 sort of response, we will need the infrastructure to be able to support it.
Thank you. And Jasmine, do you want to briefly state the operations of your unit?
Yeah, so here at ACS, we actually have 6 different type of programs. So depending on what type of program you are getting called out to, it really depends on the type of unit. But typically we have 2 folks to a unit. One of the programs that we have is our mobile crisis team unit, which is the co-response, right? They sit with the police officer and respond to high acuity calls. We also have our behavioral health unit, who are 2 units, 2 individuals that go in 1 unit together to non-emergency crisis calls that we're able to take, right? Our units usually wear ACS shirts, kind of similar to what I'm wearing now. They have some type of identifiers. We do issue jackets that do have the ACS with our city seal on it. One of the biggest pushes that we heard from the community in the very beginning was that we should not look like police officers, right? We go in, we normal clothes, trying to build that rapport within the community, and that's worked for us. We do have making great strides with individuals that usually have additional 911 calls, frequent calls on them, and we're making that approach to say, we're not unfortunate, we're not going to make you do anything. We're here when you are ready. We're here to meet you where you're at, and if it's going to take 5 times, 20 times, we're going to be here for you. And our hours of operation right now are from 7 in the morning to 8 at night, 7 days a week. We are looking into actually expanding our hours to possibly go 24/7. We're looking at what that actually looks like, what type of calls are we be able to take. Because we have been looking at this, we've actually are not only focused on the type of calls we can take away from PD. It's how can we support? How can we be there to be those individuals if there was a possible shooting, a homicide, or a suicide completion that happened in the night hours? How would our responders be there to help those families? How can we be there to support? It's not only necessarily responding to the type of calls we're getting during the day, but it's also as support on the back end. Should anything happen, we'd be there so the officers or firefighters are able to concentrate on that type of incident, the crime or whatever is happening, and our folks would be there to help with the victims' families, the individuals there, the community members, those who have just been in that traumatizing situation.
Thank you, thank you, thank you. Thank you all for giving us that bird's eye view of the whole current landscape of our national first responder scene. Now let's jump into questions about the workforce. When we talk about training, this training is, I'm sure, is completely different from what previous public safety agencies have done before. So to the panelists, what kind of training did the first responders in your community need in order to become a part of the program? And what kind of training is still ongoing as they get into the field? Let's start off with Daniel.
Thank you. So Alameda contracted with a behavioral health provider to develop training and curriculum for the staff. And the training originally, it's a little disjointed because we do de-escalation training separate from the behavioral health training, and then the 5150, which is when we place a hold on a patient, essentially take their rights away for 72 hours, is a different sort of training on top of that. And moving forward, what we really need to do is work on a more collaborative, inclusive type of training that goes from beginning to end, and so that everything is incorporated, and we can see we can see the different transitions, and when we can expect things to change and what we need to do. We also need to work on joint training. We have done, it's sort of funny, we've done more training in regards to active shooter. We have done no training in regards to working with the police during a crisis response. And don't get me wrong, active shooter is important, but this is equally as important. We need to be able to do that.
Jasmine, how about the training in your jurisdiction?
Great. So our responders are required to go through an intensive 4-week training with a few weeks of on-the-job training followed. What that means is it's basically our version of a mini academy of what we feel these responders are going to be out in the field. One of the things we take pride in is our We Care training. Our We Care training is an intensive 1-week training that utilizes actors and puts responders through scenarios that they might face in the field. And this pushes their boundaries and really helps them learn lessons, right? This is going to possibly happen. We have those actors, they're based off of calls that we actually take as responders out in the field. And these actors are able to push that limit to say, you have reached this point, you utilized, and the way our academy is structured is to build on top of one another, right? You learn the basics and then we get more intense, and then we go through the We Care, and then we provide those additional coaching and feedback during the time of the training, and then really put them through the test when they do the on-the-job training with the current responders out in the field. And then we gauge them, do the evaluations to make sure that everything is as it should be and they're ready for the field. One of our goals is to recruit and train in a way that emphasizes services, social justice, and community healing. So what we really want is to be sure that our folks have that, right, compassion, the emotional talents, that ability to de-escalate situations out in the field. We have been doing pretty good. Our training is not complete. We actually want to increase it because there are other situations that we're learning now that we could actually hone in on and provide those additional supports. Alongside the training that they're required to go through in the beginning, we do offer refreshers throughout the year so that we are ensuring that we are continuously providing those coaching and feedback to our responders.
Great. In China, what does this training look like in Atlanta? And also, is there anything that you would have done differently, or was there anything once your responders got into the field that you wish they were trained on?
Yeah, so our training in Atlanta very much mirrors sort of what Jasmine mentioned in Albuquerque. We have sort of a training period where we are going through scenarios with our staff. We are also doing crisis de-escalation, mental health and substance use identification training, so that our staff, when they go out, they're able to see someone and know sort of what is happening with them. Is this person having a mental health crisis, or is this a substance-induced psychosis? Like, just sort of getting them aware of some of the situations that they may come across. A large portion of our training is also rooted in cultural competency, specifically because most of the folks that we know that are sort of harmed by over-policing or this level of concern are Black and Brown people, trans and queer folks, and we want our staff to be able to just have the cultural competency necessary to do this work appropriately and effectively. If I can think of one thing that I probably would have done differently, and we are sort of doing differently now, is making sure that all of the trainings are as a part of a 2-person team, or however many team members you will probably have going out at a single time, but having the trainings together. And this is important, I think, because what we don't recognize is that there's a lot of dual decision making. There is a lot of like natural leadership that happens, and we want them to sort of begin operating and learning as a unit. So that way, when they're out there in the field, they can just give each other a look and they'll know exactly what the other person is saying, or they'll sort of already have that group and team dynamic that is absolutely essential when responding to these sorts of calls.
Thank you. Yeah, partner cohesion is definitely key when responding to calls. You know, sometimes I would be paired with someone who just was completely opposite of who I was and my temperament. And sometimes that makes things worse, right? So definitely team building is something that we're going to get into later on in the panel. But in terms of training, are they kept usually in-house, or are they usually collaborative with other grassroots organizations or police departments or EMS? Is it a wide range of people you work with when it comes to training, or is it usually kept in-house? Jasmine, I'm curious about ACS.
It's both. So what we've done is we have contracts with community-based organizations that actually do this work. What we pride ourselves on is being able to bolster those community organizations, right? We want our responders to know who they are. So if they are out in the field, they're able to reach out and be like, oh, during our training, you provided this service. And alongside that, one of the important things that we offer for our responders is safety, right? And we get those trainings done by both fire and police. So it's a collaborative, and they know that when something happens, they're able to call them out. Our responders are equipped with the MDTs, the mobile data terminals, as well as the radios. So they actually get those trainings from police and fire. So they're able to communicate, and that provides that level of comfort for our responders to know that, hey, if anything does happen, we are training to policy. So we tell you, like, do these things when you're responding to these type of calls, but it also provides that narrative of like, we are here to support and they're here to support us. So it's not one or the other. We do have trainings with both of those departments as well as community-based organizations. Right now, we're currently looking at what it would look like to have most of those in-house. Being a new department, we've only been implemented since September of 2021. We have had those contracts, so we're able to get up and running, but our goal is to provide an ACS training academy with the ability to have most of those in-house and increasing the amount. And that also comes with building the infrastructure of a new department, which we are currently working on now, so we can have additional admin folks who would be able to fill those gaps and basically build those additional relationships within the community and for our responders.
Hey, Jason, I know you work with several jurisdictions on first responders. What kind of training have you seen or even seen nationally being done?
Yeah, so I think related to many of the points that were previously made, one thing that we've noticed is that many of our partners and indeed lots of localities that are standing up these programs for the first time sometimes have a hard time identifying quality training that exists to help bring their staff up to speed, because there's a sort of lack of recognized and standardized training programs in this space. So there's a lot of cross-city learning that's taking place today that we've seen. You know, folks in one city will reach out to their counterparts in other cities who have been doing it a little bit longer to see what kinds of trainings that they've implemented. And we've been helping make some of those connections as well. I think, you know, the things that we've seen in particular are, you know, from sort of basic, but, you know, mental health, substance use background training for non-clinicians, focus on safety for the clinicians, things like operating safely in the field as part of a team, driving the van or the vehicle, proper use and protocols for radios and things like that. So I think it's a lot of just sort of helping everyone to understand how their other teammates are operating, particularly if they're coming from different backgrounds and different agencies and things like that. But there is quite a lot of cross-city learning that's happening at the moment because we're still working on a body of sort of standardized training programs.
Absolutely. You know, training is key. You know, this job is definitely not going to be easy, and it may entail a high level of stress when these responders go to certain scenes. But we have to make sure we're putting the right people in these trainings. Who are we recruiting? Who are we putting into these vans is going to be key. So how can we make this job attractive to the population, to America? You know, what is going to bring someone who's a social worker into this field or any other profession? Jasmine, do you have any ideas?
So being that ACS is barely new, we haven't had, thank goodness, haven't had a lot of difficulties in filling our positions. Most of our responders come from traditional social work, but then again, we have 6 different programs that allow us to say, you're not quite qualified for this position yet, but have you thought about this? So we can build that career ladder, right? We have that pipeline that starts from one of that doesn't require very much experience or education. And then that ability to say, we're going to incentivize this by offering the tuition reimbursement program, right? The city already does it, but we provide additional funds to be like, okay, if our responders are going to stay in this field and you're willing to go back to school, we'll do that. We'll pay for your school, get the education, the experience, and you start going up, right? And then competitive pay. We pay our responders as well as their benefits and everything else. They're going to be government city employees, which does add to their potential retirement with the city or with the state. So those are incentives that we're really pushing forward, is building that education pipeline, as well as ensuring that we're able to pay for the school, getting them in here long term, and that ability to advance within the department.
Thank you. China, what are you guys doing in Atlanta to make this job attractive to individuals?
Yeah, I think we are really mission focused and finding folks who are sort of aligned in the idea of like really bringing alternative to the city. I know that Jason mentioned earlier the value in peers, and we think that that is extremely valuable here in Atlanta. You know, finding and recruiting and supporting people with lived experience, people who have been previously incarcerated, who have, you know, had a loved one, or they themselves deal with any mental health or substance use concerns, or just basic quality of life concerns, are really instrumental to this work. And we don't think that we can do it without them. So they are really like our target sort of population, as well as competitive pay. I think, you know, a lot of other sort of enforcement entities have tons of funding and tons of money to be able to provide, you know, great pay to their staff. And I think that this is a field and a workforce that is deserving of that level of compensation. So just continuously advocating for more money and livable wages for this line of work.
Thank you. So this job isn't for everyone, as we know, right? What kind of qualities makes this job easier for someone to do? Or what kind of qualities make this job harder? You know, what kind of qualities do you look for in an individual when they apply for this position? Is it life experiences, or is it educational background, or is it being from the jurisdiction? What kind of qualities in the person that you look for to make this job a success for them? Daniel?
Well, currently in our staffing model, you know, we're using firefighter, paramedics, and EMTs. So, you know, they already have to be incumbents in those positions. You know, essentially, we're looking for people that have patience. Many times, these responses are pretty much an extended period of time. Our average response time on scene is an hour. We've gone up to 6 hours on a single call for a single patient. And so previously, under the law enforcement response, there was more of a tendency for law enforcement officers to try to clear the board, you know, to try to push those patients through. So they would, you know, force people to go into the hospital, or they would 5150 them and put them on a 72-hour hold. And so having patience is critically important to kind of work with people and work through their problems at the moment. Empathy is very important, and also emotional stability. You know, I'm an old man compared to everybody here on the board. So, but you know, like sometimes, you know, sometimes younger, and this is not a negative comment about like younger staff members, but you know, younger people don't have the life experience to kind of appreciate what's going on, or they haven't, you know, developed their own emotional stability yet. So someone that has that emotional stability is critically important.
Jasmine, what are some key qualities that make this job good for someone?
Yeah, I want to echo what Daniel had mentioned. Yes, we look for all of those things as well, but we also want to be sure that our responders come from the community, right? They're representative of the community. They know Albuquerque. They understand some of the what happens in this side of town happens on the other side of town. It's really getting them engaged and understand what the community is like. Their ability to build relationships, positive relationships with community organizations, our partners, other first responders that are out in the field, and know and support all of the community, right? The services that are out there. Most of the responders that we have hired actually have worked in this line of work, but in different entities. So we have folks who were working in the hospital in the psych unit who were like, we actually don't want to be on this end. We want to be in the front end where we actually connect with the individual out in the field prior to getting them sent here. Or maybe there's an alternative to not having them come to the actual hospital. So they actually have these background and experiences already. Some come with education. We have folks who come in with associates all the way to their master's level. Some who are already licensed clinical social workers. It really depends. And I think for us, we just want to be sure that they have that drive and that compassion, right? To do the work, because this is not easy. And you've mentioned it before. This is a line of work that is very hard because you get calls that you are talking with an individual who is having a mental and behavioral health crisis. Do you have that ability, the skill set, and to de-escalate them and to help that individual who is in need of your help right then and there. And just want to echo again, good candidates for us is everyone, just like China had mentioned, is we do offer different programs for peer support. So we have certified peer workers who do this line of work, as well as providing different specialized follow-ups for different calls. After one of our responders take a call on mental behavioral health or substance abuse, we have a team follow up the next day to be like, hey, I'm a peer, I've lived through this. Are you willing to go and seek help with me? And then help them along the way to get those services and treatments that they need.
Thank you. So once we've identified some of these key qualities that makes the person successful in his role, how do we target them and how do we get to them? How do we recruit them and get them on board? What kind of recruitment strategies have you all deployed or done in the past that makes these people come on board? China?
I think we're really transparent with what the role will sort of look like. And we also make sure that we have what we call a day in the life. So I think this has been really beneficial to both the recruitment and also keeping folks sort of in this line of work by having them come on, having a full day of being able to see exactly what the role will entail. They'll get to do a ride along. They'll get to sort of meet some of our participants, meet some of our clinical staff who are actually doing some of the case management. So that way there's no sort of doubt in their mind that they are capable, but they're also able to see 100% what the job will look like, which I think sometimes it's like, we don't want to scare people. We don't want them to think that this is this is a difficult task or something that is going to be hard. And, to Jasmine's point, this is an emotionally taxing job. And most social workers, we're used to that. We're used to sort of having to have a really good work-life balance and sort of taking care of ourselves in that way. So I think by allowing people to sort of come in, see the work, go out, it's been really helpful. It's been really helpful.
A day in the life. I like that. Daniel or Jason, you all have any recruitment strategies that you all have used or seen in the past that have gone well?
Currently we use volunteers within the organization. When we originally started the program, this was kind of foisted upon us by the city government, and we had an idea of what it was going to encompass. But now a year later, we have a better idea of what we do and what we need to do. I would really like to see, the ability to attract a more diverse workforce to kind of work in this space, and where we are as we continue to move forward, we'll see what we'll be able to utilize in order to attract that workforce to come to the fire department and do this very important work. The one thing I want to say is, though, that we probably need better screening for our staff members. To speak to what China said, we really did not appreciate the emotional and mental burden that's assumed by working with patients, especially patients in vulnerable populations. And for some of our younger workforce, this was extremely taxing. And so, and just to give you an idea, we don't screen people for to find out if they have a history of substance abuse, or, if they've been victims of domestic violence. And now we're putting them in situations where these very situations can be triggers for them mentally and emotionally. And it has affected our organization. So we have to come back and look at screening later on, and then what we do for resilience.
And then for myself, maybe two quick observations. We're obviously not recruiting for these folks, but two things that I've seen. One being, I think in general, there are fairly high vacancy rates in some of these roles nationwide. And it seems like degree requirements, such as requiring a graduate degree, can serve a sort of gatekeeping role and narrow the pool of eligible candidates. So I think we would do well for policymakers and program leadership to really ask themselves if they need master's level candidates for all of these roles, or is there some way in which we can sort of differentiate maybe more junior, more senior roles in order to help fill some of those open vacancies. And then the other point gets back to something that China said earlier, which is what I like to call parity among all responders. I think when we think about traditional first responders, fire, police, they have the benefit of relatively higher wages, better benefits. And it seems to me that that's based on, partially at least, on an assumption that we as a society have made and recognize that they can't do that type of work forever because it does take a toll. It is stressful, like we have said. So I think it's important to recognize the importance of the role of our alternative responders as well. I don't even really like to call them alternative responders, but anyway, this workforce is coming to play an equally important role for society, and yet they do not generally earn a comparable salary or benefits. And I think that is one way that we could increase that worker pool as well.
Jasmine, I also want to throw to you if you all have any recruitment strategies that have worked in the past.
Yeah, so ACS is a community-oriented department, which means that we value the community's input. We actually do a lot of outreach with the community. We attend different neighborhood associations, meetings, we provide those recruitment type stuff there. We also go into high schools, we work with their school counselors, kind of getting that little input of what we do and how we do different things. We collaborate on different campaigns across the city on the advertising, the social media type stuff. But most importantly, what's really worked for us is taking on volunteers as well as interns. We have working relationships with all the post-secondary institutions across the state of New Mexico, which means a lot of those folks are actually looking for places to do their internships or possibly just volunteer their time. And that's where we work with them and we say this could be a possible location or a place for you to complete those if we have the person who's able to sign off on the paperwork, as well as understanding what those requirements are. But most importantly, we're actually working with the secondary institutions in Albuquerque to figure out if we're able to develop some type of certificate program that would allow them to be a streamlined straight into one of our positions if available. So we're looking at different type of avenues to ensure that our working relationship and our partnerships with not just the city government, but outside of those entities are actually involved in how we are operating, because our main goal is sustainability. And with sustainability is understanding that we are needed here in the city of Albuquerque, and how can we make sure that we have that stream flow of responders to take on those works.
Thank you. That's very innovative for you all to be doing that. I'm definitely looking forward to seeing the recruitment retention from that. But yeah, so now we've talked about the framework or the body of these alternative responder programs. Let's get to the nitty-gritty and the heart and soul of these units. More importantly, let's talk about the workplace culture, team building, responder wellness. Daniel, I know when I first met you last year in October, we met at a conference in New Jersey for EMS providers. and you had a presentation on responder wellness and just some of the things that your responders were experiencing and how it's affected their job in your department. Can you talk about some of the most challenging aspects of your job and what should responders be prepared to face once they hit the streets?
Well, in EMS, typically, we're kind of very used to these very short assignments, where we respond, we do something, we kind of see the fruit of our effort. We take somebody to the hospital, and in regards to the patients that we work with in the crisis world, these patients are challenging because we spend more time on task and we assume the mental and emotional burden of our interaction with them. And because we're spending more time with them, the way that it affects us more deeply. And so, we really need to fix what we do in regards to training. I look at licensed clinical social workers, I look at psychologists, I look at psychiatrists, and they get that. They learn about resilience, they learn about how to identify things that are going on in their life and how to better protect themselves. And so, they go through therapy. We do none of that in our training. As a matter of fact, our training was more designed for licensed clinical social workers than it was for EMS providers. And so all of those things in regards to resilience and training weren't built in there. I would incorporate a resilience officer for my department. I would have activities that would protect my workforce both inside and outside the workspace to preserve them and help them. And then, I would look for a broad range of activities, battle buddies, utilizing something from the military space in order to address their needs. But it has to be painted with a broad brush.
Thank you, Daniel. China, what are some challenging aspects of the job that your responders have been faced with, and what has your agency done to support them?
Yeah, I mean, responding to quality of life concerns where you were, seeing people both in a moment where they are either being arrested by law enforcement or previously engaged in sort of in crisis is not easy. And so we definitely at PAD work to have some sort of comprehensive package where we are basically saying, if you need a mental health day, take a mental health day. We give extensive PTO, we give extensive vacation time, just because we understand like sometimes sort of getting away from the work, refueling, filling up your cup again is sort of like the key to longevity. But we also make sure that like we are having check-ins with our staff and really making sure that they know that they have sort of a corner to come into if they are feeling exhausted from the work or want to talk about some of the highs of the work and some of the great things that they've been able to accomplish. So just having clear lines of communication, safe spaces both within our office and out in the community has been essential.
Thank you, China. Jasmine, has your agency provided any kind of support to your responders for wellness?
Yes. So what we do is we have contracted with some community-based organizations that provide so the city of Albuquerque does have an EAP program, but to make sure that our responders feel like they have someone who understands the life of a first responder, we have contracted with a third-party entity that would provide that EAP type services. Those services are going to be provided to our responders at least 20 hours a week, and they can come into the office and just seek those services, or they can schedule appointments and just go. This is something that we've have wanted for a long time, just because we wanted to make sure that their wellness and mental health and well-being is taken care of and addressed should anything happen. We also, if they come across different challenges or calls in the field that has done, caused some type of trauma or re-triggered something, we want to do check-ins. We have them come into the office. We may, if possible, reassign them to maybe a day in the office or something that would allow them to kind of de-stress and go through that. In some situations, most of our responders are like, we've had this experience before, we're okay. We do the check-ins, we make sure that we're following that procedure to ensure that our responders and their supervisors have those daily check-ins and briefings. And that's the benefit of us kind of keeping a wide view, aerial view of our responders and what they're going through in the community.
Thank you. And Jason, can you comment on, national wellness and what you have learned from the community about their responder wellness, and even in Chicago, what have you learned about responder wellness?
Sure. Yeah. Well, and this is one area where I think back to my experience as a social worker. And of course, social workers have been doing community-based work for a long time. And it's generally safe, but anytime you're out there, things can happen. And it does, as all of the other panelists have said, it can take a toll. That's why training is really important, but so are supports for when things do go wrong. And I think all of the other panelists have highlighted some really great strategies for helping staff to deal with those issues. There's been some recent data suggesting that community violence interrupters experience fairly high rates of trauma and secondary trauma through witnessing on-the-job violence. Now, this work isn't specifically violence interruption, but anytime you're doing work like this in the community, things can happen. So there are reasons to suspect that other responders might experience similar traumas, and as was highlighted, just going and being with someone and helping them through what is perhaps the worst day of their life and spending an hour, 2 hours, 6 hours trying to help them through that issue just can take an emotional toll. So, and incidentally, there's also some good data suggesting that 911 professionals themselves experience fairly high rates of trauma and PTSD. And so to address this, many of the places that we've worked with and others that we've spoken to have sought to offer all sorts of different additional mental health and well-being supports for their responders. And I think it's important to make resources available both during and outside of shifts. We have partners who will offer counselors on site and sometimes mid-shift. And I think it's important to sort of standardize the taking up of those services. You can leave them voluntary, of course, but if the expectation is you sort of round robin and everyone has an opportunity to go and talk about those things, that can help sort of standardize the practice. We also have partners that do things like offer quiet rooms and use other neuroscience informed restorative practices. Again, not to beat a dead horse, but this does apply to the 911 professionals as well, who regularly work 12-hour shifts, lots of overtime, sometimes mandatory. So something as simple as having shower facilities and a quiet place to take a nap. So staff working back-to-backs I don't want to normalize working back-to-back shifts, but sort of recognizing that happens for some of this workforce. So, things like that can help folks practice self-care, even in less than ideal circumstances, are also important to consider.
Thank you. So we're running out of time. We have literally 5 minutes left, and I want to squeeze in one last question in 30 seconds or less, to the whole panel. What are some keys to making team building successful? What are some keys to making a partnership work well on the street? Let's throw it to Chada. I know you spoke about this earlier about the dual trainings and all. Can you want to start us off?
Yeah, I think, really starting out with the dual training and making sure that it is always sort of a one band, one sound sort of initiative, and knowing that you are always going to be with this teammate. So you guys sort of need to build a really good rapport is essential. But I also think really letting our staff know that it doesn't take superhero capes to do this work. Everybody comes to this work with great experience from a plethora of different areas. We have people who used to be teachers that come into this work with the ability to just sort of connect with people on that one-on-one level, or social workers, or any, sort of entity. And I think by allowing people to sort of highlight their strengths and work sort of in a strengths-based model has been the key to building really, really strong teams.
Thank you. Jasmine?
Great. I want to echo China because that is perfect response. But we also have the training academy, which allows all of the new responders to come together and do the training entirely together. So they build that rapport already. Out in the field, we have a couple of weeks, 3 to 4 weeks of on-the-job training, and that allows our new responders to integrate with the current responders to have that working relationship and building partnership with each other. Our units are teamed up, so they have the same team member, and then we switch folks out when needed if there was call outs or someone was sick. So they already have that interconnected relationship with each other. Alongside those, we also try to make it very more involved, right? We try to hold different special events during the month, so everybody's together, they get to know one another. And more recently, we've actually started this update Fridays. So one of our admin team will actually send updates to all of the staff and making it fun. And that's actually really got everyone involved because now they're not out of the loop on anything. They are reintegrated with what is happening with the department, where we're going, and it gives us the ability to make cool announcements on who was recently hired or who was recently promoted. So we really try to make sure that everyone knows we're one team, one goal, one mission, right, of providing that compassionate response in crisis situations at the right time.
Thank you. Daniel, what makes team building good?
Well, training, obviously, that's a recurring theme, but I think the most important thing is those multidisciplinary team exercises where you are out and you can solve problems, and like outward bound sort of things, something where somebody has a puzzle and he has to describe to other people how to solve it, and you have to work together. But bringing together everybody from the dispatcher all the way through the licensed clinical social worker, and having them to come together and get a better appreciation for a person and their talents.
Thank you. And Jason, wrap us up.
Yeah, China already touched on this, but I think as with anything, consistency is key. We've been told in countless interviews with responders that staffing consistency, working with the same people day in, day out, is key to developing trust, I think, particularly in these multidisciplinary teams. So if you think about folks like EMS, they're trained to operate as a unit. They've gone through the same training with the individual and sort of have that to fall back on. And I think trying to recreate that for these teams to the degree that can be done is really helpful. We've heard things like, I'm all alone out there, which kind of gets to that point. So there's a learning curve and it takes some time and patience. And I think just making sure that people are getting used to each other as individuals is really key to developing that ability to collaborate together.
Thank you, thank you, thank you. So we're all out of time. The hour flew by. But I just want to take the last minute we have to thank everyone for coming out today. Thank you for taking the time today to really, truly reimagine what public safety can be in this day and age. And also thank you to our panelists for sharing their experiences and giving us so much information. Thank you all, thank you all, thank you all.